Hello and welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio, and I'm glad that you could join us once again. Our guest is Dr. Sandy Feldman. She's Medical Director of Clearview Eye and Laser Medical Center in San Diego. Joining us here to talk about Smile. Thanks for joining us on the program, Dr. Feldman.
It's a pleasure to be here today.
Well, you obviously are involved in eye care at the Clearview Eye and Laser Medical Center. Did you start out on your medical journey as an eye doctor? Is that what you initially wanted to do, or did something happen in your life to steer you in that direction?
Well, when I was in medical school, during the time I needed to make the decision as to what field of medicine I wanted to enter, I was taking ophthalmology. And I had the opportunity to observe a patient who underwent cataract surgery. And in those days, we used to put patches on people's eyes. And when the patch was removed, the patient could see, and tears of happiness and joy streamed from her face. And I said, that's it. That's the profession for me.
You're one of the nation's top Lasik specialists. Explain what Smile is.
Well, it's the latest advancement in laser vision correction that corrects nearsightedness and astigmatism that provides a LASIK-like outcome in a minimally invasive procedure. And you had been describing what Smile does, and basically it uses a laser to create a very thin contact lens-shaped layer just beneath the surface of the eye, and then a small incision is made through which this thin disc layer is then removed.
So even though it is invasive, it's far less invasive than LASIK?
Yes, it has a smaller incision than LASIK does. And because of that, people can return to their activities faster. And generally, people don't wear the nighttime goggles that they would with LASIK.
So there's no type of goggles that need to be worn, or simply not the type that you would wear with LASIK?
The goggles are only worn the first night of surgery. Okay. And after that, they're not needed. So in that way, it's minimally invasive.
I've heard that sometimes if a patient has dry eye, there might be some complications or some adjustments that need to be made.
All of our procedures, dryness of the eyes can get worse than it is, already. However, because of the smaller wound, people whose eyes may be drier, Smile may be a better procedure than LASIK for them.
So before, if you were turned down or not a good candidate for LASIK, you just were, out of luck. But now with Smile, you can get the same type of results in this less invasive way. Now, both Smile and LASIK are blade free. It's all done with laser. Is there ever any part of the procedure that requires a blade?
No, not blades with these procedures. One of the nice things about the procedures, too, is that they're very rapid to perform, about 30 seconds with Smile of laser time. And worldwide, over 1.5 million Smile procedures have been performed and counting. It's not new. It's actually been FDA approved in the U.S. since 2017, and astigmatism was approved just last year toward the end of 2018. And that's why you haven't heard about it a lot in the United States. But it's been around for almost a decade worldwide, and it's performed in the fastest growing procedure around the world.
Now, you did mention that people that undergo Smile can get back to their activities faster. Are we talking a significant shortening?
Well, they can get back to most activities the very next day. It does take some time for visual recovery. However, there is healing with all of our eye surgeries. However, the vision the very next day is often good enough to do most activities. Mm-hmm. And because of the smaller wound and faster healing, things like wearing makeup can be resumed the very next day.
So how revolutionary is this?
Well, what's revolutionary about it is that it's a one laser method. It only uses 1 femtosecond laser, and that it's, performs the reshaping of the cornea slightly differently than our other, than Lasik or advanced surface ablation, which have been around since 1996 in the United States. So it's the next big thing in laser vision correction to correct one's vision.
In a Lasik procedure, if the patient develops a problem or the vision isn't as clear as one would expect, is SMILE an option after Lasik, or is it one or the other? And if there is one or the other, can it be done a second time to improve upon what has already been done?
So if someone has had Lasik, they're not a good candidate for SMILE. However, if they have had Lasik or they've had SMILE and they need a small refinement, there are procedures, laser vision procedures, that can be performed to enhance people's vision.
What about age restrictions? Is there any indication that a person's age or the degree of their eye condition plays a part as to whether or not they're a good candidate for SMILE?
As long as people have healthy eyes and they don't have any other, diseases of the eye, then SMILE, may be an option for them. So there is no older, age limit to SMILE other than it's important that one's eyes be healthy. However, if someone is farsighted, then SMILE is not a procedure yet that's approved for farsightedness.
Well, where can our listeners go online and get some more information about your practice and SMILE and Lasik?
So if they go to Clearview Eyes, ClearViewyes.com, they can find out and look at information on Lasik, cataract surgery, SMILE, and other surgeries to keep one's eyes healthy and have good vision.
Dr. Feldman, thank you for joining us on the program.
Thank you for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Sandy Feldman, Medical Director of Clearview Eye and Laser Medical Center in San Diego. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to this podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.